Good morning, everybody. Welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Dr. Earl Stoddard, who is Assistant Chief Administrative Officer, as well as a special guest, Director Anita Vassallo from the Montgomery County Public Libraries. Reporters, all of you should already have permission to record. If you do not, use the chat, as well as use the chat and identify the organization you represent once we get ready for the Q&A portion of this presentation. The county executive needs to move on to another event at 12:25 p.m. Our other two guests can remain in case we need to. And with that, let's get started. Mr. County Executive, good morning. How are you?
I'm fine, mostly. If you hear me clearing my throat every once in a while, it is the continuing lingering effect of my 13-week interaction with COVID. So this is still here. I want to thank you for joining me today for our briefing. I'm talking to you today from the Potomac Community Center. Immediately following this briefing, I'm going down the street to the Islamic Community Center of Potomac for a funeral service for Tufail Hamad. Tufail was a real pillar in our community and a major presence in the Muslim community. I knew him for more than 20 years, and he was a tireless leader for justice and as honest, gentle, and compassionate a human being that I ever had the honor to work with. He saw all of us as part of the human family. He worked tirelessly for everyone in Montgomery County, and he never grew weary of striving to do more and better. He was not shy about needs in the community and advocating for the community. He always saw the whole picture, and he always understood that we were all bound together in doing this work. I'm going to miss him as a friend and partner in the work to build a more just and understanding society. And Montgomery County is going to miss him as someone who always strove to be the best person that he can be. And my condolences to his family and to all of his friends. We are going to miss him, and I just wanted to start with that. Back to COVID. This week, we're seeing reductions in both our test positivity and case rates. Our positivity today was almost 17%, which is about a 10% reduction from our peak in the surge, which was 27% on January 5th. Our current case rate is 1,193 per 100,000 residents. This is a 44% drop from a recent high of 2137 on January 9th. And although these numbers are going in the right direction, they're still among the highest rates we've seen throughout the pandemic, and over 8 times higher than they were at the beginning of the month. So getting lower numbers is a good thing, but the numbers themselves are not good things yet. They're just a sign that we're moving in the right direction. The bottom line is we still have a long way to get back to where we were just a very short time ago. We're also seeing numbers drop slightly in our hospital bed utilization rate by patients with COVID. This is the lowest number we've seen in 2 weeks, and it's welcome news for our hospitals and our frontline healthcare workers. That said, our hospital utilization rate is 6 times higher than it was at the beginning of last month. One data point that we see that is still increasing is our COVID deaths per day. Due to the county's high vaccination rate, you can see we're still significantly fewer deaths than the state average. Montgomery County represents 17% of the state population. We're only showing about 8% of the deaths from COVID this month. On that data point, matters. This shows how important it is to be vaccinated and boosted. There is a significant difference in outcomes for people who've been vaccinated and boosted, and we continue to see that in cases and the severity of cases. Regarding schools, we continue to see disruptions from the surge in cases in the school. Yesterday, MCPS announced that 16 more schools would be moving to virtual learning starting tomorrow until January 31st. I support these decisions made by MCPS, and they're in the best interest of the health and welfare of the students, staff, and families. I want to make a few points. We all wish this were more predictable and easier to manage, but it's not. Omicron proved to be dramatically different than Delta, so everyone has had to change their approach. I know that for the school system and for a lot of what we did, our assumptions and plans back in the fall of 2021 were based on the Delta variant. Those assumptions and plans do not match Omicron. And so all of us have to change our approach to dealing with the virus because it's really a different virus that we're dealing with now. Same name, very different mode of operation, very different level of infectiousness. I know that this is extraordinarily difficult for everyone in the schools, staff, students, teachers, and families. It is disruptive and it's exhausting for teachers and other staff who are filling in for those who are out. Teachers are giving up planning time and lunchtime to fill in, and parents are stressed too. Many are concerned even more than they were in the fall. In the fall, when we were dealing with Delta, which was much less infectious. Other parents are concerned about learning loss, which is a concern for all of us. As changes are made, the important thing is to constantly and consistently monitor what's happening and respond to changes in a timely manner. Clear metrics are needed and they need to be applied in a timely manner so parents, staff, and students have some sense of how to and what to expect. And some of those metrics have to deal with the operational shortages. Omicron has created big shortages of bus drivers, teachers, paraeducators, and other staff. And that makes it extraordinarily difficult in some cases to maintain learning. The school system, isolated in these staff shortages. The county government is suffering from staff shortages as well. So this is the nature of work, whether it's in the school or in the county government or the private sector right now. Messing with staffing levels and creating problems. We're going to continue to work with MCPS to help them acquire more rapid tests. We've already provided about 240,000 tests to MCPS and are working with them regarding the contact tracing following their request yesterday. As a government, we have our own limitations and staffing challenges, but we're going to do what we can to ensure both the health and education of our children. One place where we can find some comfort is that the particular surge is temporary. When it will end is unclear, but I don't think we're talking about months, we're talking about weeks to get us out of the worst of it, assuming the virus doesn't have any more pleasant surprises for us. Around the world, it looks like the virus ramps up and then ramps down on about the same pace. And if that's the case, that would put us maybe a month away from ramping down to a more reasonable place. But hopefully we're moving in that direction. 2 weeks ago, I said that we were going to have a 3-step approach to combating the surge in the county. We can see from our numbers this week, this which is helping, but we have to remain committed to this plan until we bring these numbers back down. The first step was ensuring had access to testing. So far, out of the 2.1 million rapid tests that we've ordered, we've distributed 792,000, given 240,000 to MCPS and an additional 60,000 are going to childcare providers this week. We've given out over 303,000 tests directly to our residents at our county libraries in just over a week and a half. These are incredible numbers. In the first week since the launch of the report test, we've had over 900 residents report their test results. We want to encourage residents to please let us know when you're positive, but also let us know when you're negative if we're trying to figure out how many cases are popping up versus the number of people who are being tested. Only getting the positive numbers is not as useful as getting both numbers. It helps us to better understand and identify where the virus is spreading in our community. I'm also pleased that the federal government is mailing out free at-home COVID tests now, and I encourage all Montgomery County residents to order these tests at https://www.covidtest.gov/. Although we have ordered a lot of tests and are still waiting for 60% of our shipments to arrive, we continue to discourage hoarding of rapid tests so everyone can access them. Utilizing all opportunities such as this offer from the federal government so that every at-home test or everyone at home can have these tests on hand. I just want to mention that one further challenge has been the government is asking suppliers, at least the one we're using, to prioritize meeting the federal government's demand for test kits. And of course, our concern is that will interfere with the supply of test kits that were being given, but on the right side, everybody's going to be able to order test kits from the federal government. Our vaccination rate and boosting, the second step we wanted to do is double down on our efforts to get residents vaccinated and boosting. You can see from from this chart, we've given out first doses to 1,050,929 people. Fully vaccinated are 893,000 people, which is 85% now. And the booster, though, is only in the arms of 416,000 people, which is about 46%, 47% of people who could get the booster. And I want to emphasize this again. I said it last week. The booster mattered. We know that the efficacy of the vaccine wanes. We know that if you're counting on natural immunity, it also wanes well. There's clinical evidence now that the boosters restore the protectivity that was associated with first two shots of the vaccine. So it's important, if you want to continue to stay healthy, to get those boosters. So please take advantage of them. We've got the booster shots in the county. You can mix and match. We're ready to give you a shot. Please come in and get your shot. The third step Montgomery County was using was mitigating the spread. I believe our proof of vaccine legislation will be helpful. I'm glad the council is holding hearings and getting community feedback on the legislation. I listened to some of the concerns and criticisms raised, and I expected that sort of feedback. However, I don't accept the premise that implementing this legislation won't help us reduce our transmission rates, especially want to call who are talking histrionically about shutting down businesses. This only really applies to restaurants, movie theaters, and gyms. We're not shutting down businesses. We're doing this to control the spread so we don't have to shut down businesses. And these businesses aren't being shut down. The goal of the bill is just to require the people who come into the businesses are already vaccinated to help minimize the spread among the rest of the population. That's it. No closures, no shutdowns, none of that stuff. And in the county, where 90%, 95% of our people are vaccinated and 85% are fully vaccinated, no one's going to be losing any customers. So DC is doing it. We need to do it. This is a temporary measure, but it's one of the things I think we need to do to help mitigate the spread of COVID here. DC began implementing their proof of vaccination last weekend with little issues or disturbances. This is going to be a tough vote for our council, but I do hope they follow the lead of the district and help us get through the surge. I've actually, gone to places that require proof of vaccination. We're not requiring some kind of special passport. And every time it's been as simple as walking in and somebody at the register or somebody who's seating you says, can you show your proof of vaccination and your driver's license? And they're asking, so everybody has it ready. You show them the proof of vaccination and driver's. That's it. No long lines, no massive delay, no nothing. So this is minor and hardly a major setback to the normalcy of our lives. So again, I hope that the council acts on this. Another key element that's helped us reduce community transmission is the wearing of face masks and face coverings. We know that masks work. Today, I'm happy to announce that starting Friday, we'll be giving away N95 masks at our libraries during rapid test distribution hours. So if you're interested in getting an N95 mask, which is recommended by the CDC, having these higher quality face masks as compared to simple face coverings will increase the amount of protection you get. Montgomery County residents can pick up the free N95 masks at 19 county branch libraries beginning Friday, January 21st. Last Friday, CDC updated the mask guidance to emphasize protection to prevent the spread of COVID-19. N95, KN95, and KF94 respirator masks are masks that have been shown to provide higher levels of protection against COVID. And residents can pick up 4 ZYB-11 masks, which is a brand of N95 mask, per person at any one of our 19 libraries beginning the 21st. Supplies are limited, and the masks will be available on a first-come, first-served basis. Today, I'm pleased to be joined by our library director, Anita Vassallo. I want Anita to share with you her thoughts and perspectives on our rapid test distribution, as well as talk about logistics of how we'll be handling this. Two other things I want to add before I close. One is I want to thank all of the county staff who've helped us with storm cleanup, and apparently you're going to get some more practice at storm cleanup, possibly over the coming week, maybe twice. They did a really good job, and I want everybody to remember they're working with staff shortages as well. They did a good job getting the roads and keeping the roads clear. And I just want to thank them for that, because it's hard work, and it's hard work when people are being asked to do more work with fewer people. And I want to also note that there was a bill introduced into the General Assembly today in Maryland that would make it a crime to threaten public health officials. Our public health officials have really been subjected to a lot of scary threats and abuse, and this should not be tolerated. You know, any of us who saw the kind of emails that Dr. Gales was getting when he was here, all of us were shocked. I mean, the language, the coarseness, the viciousness of the kind of attacks he had to put up with, nobody should have to put up with, let alone somebody who's trying to save your life. So I'm glad this legislation is being introduced. I wish we were retroactive, but it's important to get on the record and protect health officials. They're here to serve us. They do this work because they're experts in the field of health, and their goal is to keep us all safe. They deserve our respect. We have differences of opinion. Some of those differences are less informed than others. But whatever the case, threatening a human being, threatening a doctor or a public health official is just absolutely unacceptable. So I'm going to stop there, and I'm going to turn this over to Anita for some brief remarks, and then we'll hear from Dr. Stoddard. Thank you.
Well, thank you very much for the intro, County Executive. I'm very pleased to be able to be here to talk about what libraries are doing with the test kit distribution, along with Dr. Stoddard. So on Monday, January 1st, Dr. Stoddard met with library administration to first broach the idea of having library locations provide the rapid test kit distribution. And a week later, on January 10th, we were doing it. It was an amazing amount of pulling together by so many departments of county government, both libraries, the Department of General Services, Health and Human Services, the Office of Emergency Management and Homeland Security, Technology and Enterprise Business Solutions, just a whole raft of people who pulled this together in order to be able, first day, our distribution to distribute over 90,000 test kits to community residents. So my thanks goes to all of those folks. And of course, to the staff that's been working with the test kit distributions. At most of the libraries, we are doing this either in a meeting room that has an external entrance or just within the vestibule area. So although people may have seen large lines and a lot of traffic issues the first week, it really wasn't impacting inside the library in terms of regular library business. Our library staff who are passing out the test kits are volunteers. We have had support with volunteers from HHS, from OEMHS, and also from the Medical Reserve Corps, which is a great group of medical professionals who are donating their time in the response to COVID, I believe across the country, but certainly here in the Washington area. So a lot of people to help, the management teams at each of the branch libraries who are helping with the logistics of getting the boxes of kits to the volunteers to hand out. At library administrative staff who helped pull together so much, including our real-time test distribution list, which you can find on our website that to check to see if library is out of tests. Today was the beginning of the second week, and we did notice that the demand, or yesterday, had gone down a bit. This may be because of the announcement, of course, by the federal government that they'll now be mailing 4 test kits out to each address. As the CE mentioned, this coming Friday, we will begin providing 4 N95 masks to each adult who comes to our test kit distribution. The masks will be available during the test kit distribution. Those hours are available from the library's website. So we have 9 libraries providing test kits in the morning hours from 12 to 2, early afternoon, and then 10 libraries providing the test kits in the late afternoon and evening, so that people have a variety of times when they can stop by. Our community has been very, very appreciative. We have received many comments from people thanking us so much for participating in the test kit distribution. I know that you've probably seen video or pictures of long, long lines. It can look daunting, but they move very, very rapidly. I participated in the test kit distribution on the first day at the White Oak Library, also Marilyn Praisner and Germantown. Very efficient. People are in and out within a minute in terms of picking up the kits and being ready to go. So that's how it is working for us here in Montgomery County. And I think libraries are a great place to provide this service to the community. We have 19 locations around the county. Libraries are a trusted institution to many of our residents who don't feel comfortable in more official government facilities. And we are very, very glad to be helping with this. Thank you.
All right. I just have a few additional opening comments. I first want to talk about, I know that there's an ongoing education and culture meeting with the county council right now with many of our HHS partners as well as MCPS partners discussing, how that partnership works and how MCPS is responding to COVID and sort of some of the additional items. They did make, before the Board of Health yesterday, 2 additional requests for support from the Department of Health and Human Services. As I believe Dr. Kroll just made clear to the council, we received those requests on that briefing. I did not get them ahead of time, so obviously we had to react to them. We met yesterday afternoon. The 2 requests, as a reminder, were MCPS wanted to get out of the contact tracing business, as they described it. And they also wanted, I believe, 190,000 rapid tests provided to them every other week, which is about 95,000 kits a week. So I'll talk about them in that order. So contact tracing, obviously what's happening in MCPS is not actually traditional contact tracing, it's contact identification. And that is where you identify the close contacts of a known COVID case so you can determine who needs to quarantine and who doesn't. So you can provide that information to parents and families when their child is being, obviously sent home as part of a quarantine or notified that they can't attend the next day. Typically, that process looks like teachers and identifying who was proximal to a known case in a classroom. They provide that to the central office, and often the central office is making the calls to parents to determine vaccination status, to determine whether the person actually needs to quarantine or not. So we will be providing them some additional support, but I want to make some things clear in the sense that MCPS cannot be uninvolved in this process. The first line of contact identification is simply identifying who was proximal to a student in the classroom. That information lies with the teacher in the classroom and the teachers throughout the building who may have had the index case in their classroom. And so there's no situation, there's no jurisdiction in the state, certainly there's no jurisdiction that I'm aware of regionally or nationally where the local health agency is exclusively doing all parts of the contact identification process. The schools have to be involved, they have the information. We will be providing them additional support to support that, to alleviate some of eliminate some of the backlog or work that they have to do on that contact notification and interface process, but they will still have to be involved in that front end process. There's no way around that. On the rapid test distribution, obviously, as Director Vassallo alluded to, we've been making test kits available throughout the community. We have seen a significant slowdown in deliveries of our rapid test kits. We are informed by the vendor that we've been working with, the same vendor that DC is working with, that the Department of Defense just placed a 200 million kit order that they demanded 10% of those kits up front, which is 20 million test kits. We have seen a dramatic slowdown as a result of that in our deliveries. We were expecting a delivery to be shipped on January 14th and January 15th. I know I talked to members of the media about that. That shipment still has not arrived. We were informed this morning that there was a delay, that they're actually sending it out today, which means that we have essentially 0 test kits in our warehouse for the remainder of the week. We have pre-positioned test kits at our libraries, but that means there are going to be no additional kits available for any other provider at this point until that shipment does arrive. We have a number of community centers or community partners who have reached out to us. We have MCPS, we have private schools, we have childcare providers, and we have a number of opportunities aimed at our disabilities and other communities. And obviously we want to service all of those requests, but until we receive that next shipment, we're left in a significant bind. Thus far, as the county executive has said, we have 240,000 kits that are provided to MCPS. We are committed to continuing to provide them rapid test kits, but we are also looking to work with them to prioritize how those kits are distributed, because families like mine, I'm part of the MCPS system. I've been able to order and acquire test kits through ordering, and I don't need MCPS to continue to provide my family test kits. We can meet the testing burden without it. So we want them obviously to focus the test kits on those communities that do not have as ready access to rapid test kits moving forward. So we will continue to provide them support, but we want to make sure that that support is right sized in the context of their need with all the additional capabilities that are out there for rapid test kits availability at this time. So I will stop there, and I think we are good to take questions.
Thank you, Dr. Stoddard. Thank you, Director Vassallo. I do not see any requests, questions on the chat from members of the media reporters. All righty, Darcy Spencer, NBC4. I believe you have a question. Good morning. Actually, good afternoon. Darcy?
Sorry, I don't do a whole lot of these, so sorry for the delay. A little bit of on topic and an off topic question. As far as the mass distribution, just checking to see what the count is, how many you have to distribute. And then I wanted to ask the county executive something off topic.
We have about 4. So just so we're clear, the state of Maryland, the governor did announce that he was going to make local health department make masks available to local health departments to distribute. These are actually not part of that effort. We haven't, to my knowledge, we haven't received those masks yet, but these are actually out of the stockpile that Montgomery County had acquired earlier in the pandemic. We have approximately 4 million of the mask type that the county executive described and distribute those to the public. So approximately 4 million of the ZYB 11 masks.
And that cannot be for kids, right? These are only adults.
Correct. They're only adult sized. I don't know whether if the allotment from the state includes child size, we would obviously include those, but at this point, all we have are the adult size.
Okay. As far as the county executive, we have received a press release from some community activists regarding the Police Accountability Board. And I believe you're familiar with this, that they want some changes to that legislation. And among the things they're saying that it fails to reflect the community inclusion and things like that. That's something that's under consideration now. And as I understand, you wanted this legislation, but some of these activist groups are not happy with some of the items in there. Just could you give your response to that?
Yeah, I'm actually let Dr. Stoddard explain some of this, but I'll just say in general, I wanted this legislation. I'm not happy with some of the implementation guidance that's coming from the state and maybe coming from the state. The goal of the group, and Dr. Stoddard can talk more about it, is when they wrote this was to write a framework based on the legislation, knowing that it was going to get modified. I mean, there are changes I want to make, but we weren't going to make changes without a public process. And so we're anxious for this to go in front of the public and make changes. I probably agree with most of what other people want to change, but I want Dr. Stoddard to make clear where this thing came from, because people keep referring it to as my legislation and my bill. And this is like seriously wrong.
Yeah, I want to explain a little bit about this process. So in the county, we have what's known as our Reimagining Public Safety Implementation Committee. That is comprised of both members of the executive branch, but also members of the county staff, specifically Mr. Bob Drummer and Susan Farag. There are a number of members from the executive branch. Myself, I actually co-chair it with Assistant Chief Darren Frank. Back in October, we group were focused on the October 1st implementation requirements of the Police Accountability Act. Those included the Public Information Act changes and a few other changes that need to be made. After those changes were implemented by October 1st as required, we transitioned over to looking at the Police Accountability Board and the administrative charging committees as work that we needed to accomplish. When we looked at the timeline of that process, we knew that this was going to be extremely tight in the sense that in order to meet the July 1st requirement, we had to have a Police Accountability Board legislation enacted, had to have a board nominated and confirmed. We had to have staff hired for the Police Accountability Board to staff it and allow it to function. We had to have a request process for them, or not a request process, a complaint process for them to be able to receive complaints. And because the Police Accountability Board actually names several members of the Administrative Charging Committee, they need to be able to name those members, have them be confirmed and trained, and then those members develop their own internal processes for the Administrative Charging Committee to operate. Given those timelines and the uncertainty that the county executive alluded to, we know that the Maryland Police Standards and Training Commission is developing regulations pursuant to how PABs and ACCs operate and are, the requirements, including membership of those committees. Those have not been released yet. So we know functionally that there is more information that's going to come from the state that we have to act on. And so what we did is we developed a draft regulation or draft council bill for a vehicle to allow for a public conversation to happen, even while we recognize that the ground that we were building under was made of sand, because the state is going to enact more regulations that influence what we can and can't do. So this bill was originally drafted by Mr. Drummer from County Council as a base draft. He did that as part of the committee, not at the behest necessarily of the council itself, but as a council member participant, he took and volunteered himself to draft the original version of the bill. We modified that original version as a committee. The committee met at the end. Mr. Drummer asked, do you want the council members do you want me to find a council member regulation, or do you want it from the county executive? My mistake based on this whole process is I said, hey, we wanted this to be a collaborative process. I'll have the county executive council so we can show this as a collaboration. That effort has been utilized to undermine the county executive, as if this regulation was meant to be the final product. We knew as a committee it wasn't going to be the final product because there's so much changing. But obviously, in acting in good faith, we're partnering with council staff to get it submitted so we can do this public face process and meet the timeline laid out by the legislature. That's the background on this. We knew, and I made clear that our submitting it on behalf of the county council did not in any way give up his ability to suggest changes. We knew we were going to suggest changes to the bill that we had submitted because it had been drafted under a lack of knowledge about what is still coming. We have heard about some draft ACC regulations that will directly impact what some of the advocates in our community want to be part of this regulation. And they may, in fact, limit what some of the things that we can do are in terms of membership, who can be qualified, whether the Open Meetings Act applies to the groups or not. Things that we don't necessarily support that are being suggested by the state committee, but we're aware of in the background being out there. Sorry, I took a long-winded explanation there. There's a lot of background there, but I just think it's totally unfair that the council is throwing this back to the county executive because it was developed in concert in a group that included council staff and executive branch staff. The proposal by the county executive was done as a reflection that this was going to be a partnership in process. We recognize there's a lot of community feedback that needs to go into this process, but we needed to start the council process to allow that lengthy feedback process to take place. If we had done a lengthy feedback process in the beginning, I don't think it would have obviated the council from doing that same lengthy process for them as well. And we would not have had the legislation in place in a timely enough fashion if we had done both of those things. We have to have it in place July 1st. The alternate process is effectively gone at that date, and we need to have a process in place by July 1st. That's legislatively mandated, not something we chose to do. And so I just want to make clear what the background and process on this are. We recognize there's a whole lot more community feedback to be needed. We are meeting with advocates this week to discuss those things. We never viewed this as an endpoint bill. This was simply a vehicle to get us through the process.
I'll just add one other thing. I believe I'm correct that Mr. Drummer referenced that he had consulted with council members. So this idea that when they're all standing up there is like, what bill? How'd this happen? You know, we weren't part of it. Actually, they were. So making everything political is not a way to do business around here, and to not to take ownership of something that they were part of. You know, I think there are plenty of reasons, as Dr. Stoddard said, to explain why this bill is a draft and it needs to go through a public hearing process. But everybody was engaged in this. And so I'm kind of surprised at the attitude of some members that this is somehow shocking to them.
Thank you, Mr. County Executive. Thank you, Darcy. Next, Steve Bonnell, Bethesda Beat. Good afternoon, Steve.
Afternoon. I just want clarification. So the masks that are going to be given out starting Friday, there's 4 million of them, and you've had them on hand. Can you just provide clarity on how long you've had these?
Yeah, so during the surge in the hospital, you know, earlier surges in the pandemic, so we actually created a stockpile that allowed us to say, you know, if we ran out from fire rescue, if the hospitals ran out, if our nursing homes ran out of N95s, we were going to be the backstop to all of those organizations. And so at earlier phase in the pandemic, we wanted to make sure we had a reserve so that if the system collapsed, as it did at various points during the pandemic, that we could backstop all of those organizations that we knew would create a health and safety risk if they didn't have those protections. But as we've gotten further into the pandemic, we've recognized, and as CDC made their change in recommendations, we said, okay, well, we've got these masks. They seem to be more readily available. The federal government's going to make some available too. So now we feel that we can comfortably release our supply and burn through our stockpile, because we don't believe that there's going to be a limit should the hospitals or other organizations feel pinched in theirs. But because we always felt we needed to be that backstop, we wanted to make sure we had some level in reserve so that we could sustain the local health system in Montgomery County should the supply chain infrastructure fail them again.
I guess this might be, you know, a week or two. Like, why not start it when you did the test kits, though, in terms of the timing there, in terms of when, you know, was starting the test kits at libraries?
So we wanted to make sure that we had the logistics in place to do the test kit distributions. Obviously, that was an important thing to us. And obviously adding on, you know, candidly, the masks actually take up more volume. They're more logistics to move than the test kits are. So we wanted to make sure we had a system in place that could actually operationally execute this. We didn't know how efficient the libraries were necessarily going to be. They surprised us positively with their efficiency. So I'm you know, smiling at Director Vassallo. I think we weren't sure exactly how fast we were going to be operating. We will operate a lot faster than any of us expected, I think. So when we saw that how efficient it was as a distribution mechanism, how well it was received by the public, then we said, let's just add in the mask. But we wanted to make sure we had a system that could operate well in doing those things first.
So do you still have, even if you get these 4 million out, you still have some of these masks? Like, how many do you have left, I guess, if you know?
We'll have, I think, a couple million at the end of this after we distribute these 4 million. I can get you a firm number, but we got a variety of different types. We wanted to, obviously, we're doing this distribution. We're using all of one type, which is our most populous version. And the other masks that we do have, are largely in reserve for, we have fit tested employees on them, meaning our fire rescue, police, corrections officers have been fit tested largely on these masks, HHS workers, for example. And so we're holding back in reserve those masks that our employees have actually been fit tested on, and that also our hospitals utilize. So we'll have a couple million at the end of this that we can utilize.
And I've broken record on this, but the rapid test kit situation, you know, you're competing with the DOD, the DC on these shipments. I mean, do you have any contingencies if they don't get these kits? You know, you said they're coming today, but what's the plan? Go ahead.
Yeah, no, I mean, it's frustrating for us. It's frustrating for the county executive, I'm sure. I mean, we've fought tooth. I mean, obviously, we've gotten many more of these kits out into the public than any other jurisdiction around us, with the exception of DC. I think they're probably ahead of us because they started earlier. But obviously, we've, you know, as we said, 792,000 have been shipped out of our warehouse, meaning they're in various points of distribution at the libraries, child care centers, et cetera. So we've gotten a lot out. Obviously, it's frustrating to get a lot out. People appreciate that we've done it, but then obviously it's frustrating to just randomly be told by the vendor that, hey, we're not going to get our shipment that we were originally promised. But this has been part and parcel for a lot of this pandemic, where we don't have a great national infrastructure. So you go find a partner, everyone sees that you found that partner, they all rush to that partner. and then that partner dries up. And so that's just the way this works when you have a very decentralized, fractured production system.
All right, thank you.
Thank you, Steve. Kate Ryan, WTOP. Good afternoon, Kate.
Thank you so very much. I appreciate it. And forgive me if this has been asked and answered. I'm just coming out of the Education Committee hearing. But on the mask on the test kits rather, how many test kits are you backed up for the school system? I know they wanted 190,000 every 2 weeks. Is that right? And how far backed up are you? And again, as you suggested, is this just hey, everybody else found the really good source we had that made these so available for us before, or is there something else at play? And then I have a second question on contact tracing in schools.
Okay, I did address these in part, but I'll try and give you what I said earlier, Kate. With rapid tests, we obviously are going to continue to provide rapid tests to MCPS. We're gonna work with them to figure out what the right size of the amount is, because as I alluded to in my earlier comments, I know many parents, myself included, do not need MCPS to be providing us rapid test kits at this point. We've been able to successfully order them and receive them. We do know that there are families that have not been able to acquire test kits for various reasons, and we want to make sure that those parents do have access to them. So we want to right size the need within MCPS to provide to them. Given that we have had a library distribution, we're focused with community groups, we're doing it through child care providers, we're providing a number of different avenues for test kits available. So we don't think that MCPS should be testing every student, asymptomatic or not, every week as a mechanism in school, given that these rapid tests are still not coming in at the quantity we need. So we will continue to provide MCPS with rapid tests, make no mistake about that, but we're going to make sure that we're going to right size what we provide to them based on the actual need that they're trying to address. And so we will be providing. Now, as I alluded to in my just earlier comments here, we do not have anything in our warehouse to provide to anyone at this point. Until we receive our next delivery, there will not be any distributions to our municipal partners who have got clinics scheduled or distribution scheduled, to our community partners, to our child care providers, et cetera. There will be not additional allocations for those until we receive more kits. We have functionally given out everything that we've received, and the delays in our shipments arriving is going to force us to pause some of the things.
Gotcha.
Yeah.
Have they given you an ETA on those shipments?
Yeah, we were originally told that they were shipping out on the 14th or 15th, and when we reached out to them saying, "Hey, why haven't they arrived?" They said, "Oh, they didn't ship out until today." So my guess is Friday or Saturday, given they're coming from New York and it's about a 48, 72-hour timeline. So my guess is they'll probably arrive Friday or Saturday, at which point we will make an allocation to MCPS, we will make an allocation to childcare, we will make an allocation to our community partners.
Gotcha. Thank you. And on contact tracing in schools, in the Education Committee discussion, Sean O'Donnell and Mark Hodge said that right now there are 20 additional staff to help, DHS staff, to help with contact tracing in the schools. But he made this statement, and I don't understand it. He said, even with that help, they cannot do the contact tracing in the schools. They can't enter the schools. Why is that? Couldn't they just do this as we're doing here virtually and interview teachers and staff? Can you tell us what the complications are here?
So I think that's the point that he was trying to raise. So the person, when you think about a classroom experience, right? You have a student in a classroom who ends up testing positive with COVID. When they are trying to assess who are the close contacts, really what schools are doing is not traditional contact tracing, meaning they are trying to rapidly identify close contacts to provide them information about whether they need to quarantine or not. They're not doing the contact tracing of figuring out where the student who is actually an index case was exposed and try to backtrack all that. That's what traditional contact tracing really is. They're doing contact identification to a specific a case in the classroom. And so the person who has the information about who was proximal to the index case in a classroom is the teacher. And that's the point that Mark was trying to Mr. Hodge, sorry, no, I know him very well. So I know this is what he's trying to raise is there is no point where MCPS is uninvolved in this process. The teachers have the information about who was next to Jane or Jimmy or whomever in the classroom and can say, these are the 4, 5, 6, 7 students who were close. Now, where we can assist is once those teachers identify those number of contacts is contacting families and parents and making them aware of the exposure and identifying vaccination status, because if they're vaccinated, they don't actually have to quarantine. The teachers are also involved in are the exposed students, were they effectively wearing masks at the time of the exposure? That's the information the teacher would have. And so they can say, okay, yes, they were. We don't have to quarantine those students. And so we can support them in this effort, but there is no jurisdiction in the state of Maryland or anywhere that I'm aware of where the teachers and faculty of a school are not involved at all in the contact identification process, because they have the information about the potential exposure points. We can help them in the back end process of calling parents and finding out the back end information, which is what we're offering to do. But just to make clear, there is no divorcing them from a role in this overall. And so it's going to take some level of time for MCPS to participate in this, just because they're the only ones who have the information. Furthermore, the traditional contact tracing process is typically a multi-day process. That does not work for MCPS's purposes. If you look at the Maryland Department of Health's data, it's published right now, I looked at it updated for last Friday, they were contacting 17% of the positive cases in the state of Maryland within 24 hours. That tells you how stretched thin contact tracing as an apparatus is. They're very well reflective of what's happening in Montgomery County as well. And so for MCPS's purposes, only getting to 20% of the students who need to be contacted traced in a single day would be a disaster. And so obviously their contact identification process is very different from traditional contact tracing. It requires immediate knowledge of contact identification, but a much less in-depth analysis, which is what traditional public health does. And so I think I wanted to bring that up because what they're asking us to support is not actually contact tracing. It's contact identification in a classroom. And so we are going to provide additional support for them, but there are 209 schools. All 209 schools are going to have to be involved in that process because they have some information. We're going to provide them additional staff to make it easier and lessen the burden, because we agree that they should be focusing more on education, but they're not going to be totally removed from this process.
Got it. And lastly, for quick follow-up on the test kits, how many are you told are in transit right now? Do you know how many you're going to receive in this next shipment?
Yes. Yeah, so
and how many would go to MCPS?
It's 196,000 in all shipments that we receive. It's, they break it down by pallets. So it's 196,000 kits that we receive. And, we'll likely give out an allocation of 50 or so thousand to MCPS, but I won't know that final number until we talk to them. As I said, we'll talk to them. If it ends up being 75,000 or 30,000, it'll be a conversation with them to figure out what is reasonable based on how they're allocating them and how they're distributing them and who they're targeting. And so, but it likely won't be the full 95,000 per week that they asked for, because obviously that's more or less half of what we're receiving. So we need to make sure that we're serving other vulnerable partners as well, like childcare, some of our at-risk communities, et cetera. So, we will certainly lessen our library distributions to support MCPS further, and we'll have to do that. But obviously, we want to make sure that other partners have access to the resource as well.
Got it. Thank you very much.
Thank you, Kate. Next up, Nate Dill, Axios DC. Good afternoon, Nate.
Hey, good afternoon. Thanks. Junaid Dill with Axios. I sort of had a forward-looking question, sort of now that we're coming down from the latest surge, what's the approach going to be to dealing with the pandemic moving forward and with other potential variants? I mean, I think everyone would have liked to have the testing and the mask distribution and ramp up before Omicron hit. Is this going to stay around? The sort of that infrastructure, is it going to be ubiquitous going forward?
Yeah, it's certainly our intent to not operate as if Omicron will be the last variant. Obviously, we will in between phases, restrict. I think it's reasonable to relax restrictions when cases aren't high. I think that's obviously where we would be. And I think county executive alluded to this with the proposed vaccine requirement, is it would be a short-term remedy, as the mask mandate currently is, for when cases are surging. Obviously, those things would presumably roll back as we see Omicron lessen and move to a lesser level of infection. Now, obviously, there could be another variant of concern. and we want to make sure that we restock our supplies and resources and capabilities in between these variants. Now, I don't know when that'll come. It could be, we could be clear through the summer, or we could not be. So we obviously will quickly move to sort of restock and resupply and make sure that we have an on-hand capability to respond more rapidly than we did with the Omicron variant, because I think just because we're finished with the pandemic doesn't mean the pandemic's finished with us.
Yeah, I just want to add quickly that, one reason we've got like the masks to give out is we made a decision to supply ourselves for the future, because we anticipated that anticipated that COVID wasn't going to be done with us after the first visit, as it proved to be true. Stockpiling tests may be more problematic because, like we know with these tests, some of the reports say these tests are less sensitive to Omicron than they were to earlier versions of the virus. So I don't want to stockpile enough tests for 1 million people only to discover that the next variant has figured out a way not to be detected by it. So I think there's a balance that we have to have in terms of knowing, that the most effective equipment is what's going to be available, and that we can have an appropriate supply of it going forward. But we understand the need of trying to get ahead of this curve, and we are going to try to stay ahead as much as we can.
Thank you, Mr. County Executive. We do know that you have to head out to attend that funeral. Thank you for joining us today. Thank you, Kinnaid. I think we do have a couple more questions from Scott Groom, WUSA 9. Good afternoon, Scott.
Hi, everybody. Earl, we really appreciate the detail you just got into in Kate's questions. I'm hung up on testing too in the school system as well, because they handed out, I think it's more than 300,000 kits. I've been unable to get any sort of answer from them on how many parents reported into the county, what the results were, sort of what a result rate, reporting rate would have been, and what the results actually indicated. I mean, their dashboard shows 11,000 active quarantines right now, 9,000 active cases, 24,000 total students quarantined. And then, I'm just really struggling to find what this testing protocol in schools has produced. Have they shared any data with you, which helps us understand what's going on? Have they shared any data with you from what this first round of testing they did produced?
So I'm not privy to the data they provide to us. So I honestly didn't ask. So we could certainly follow up, but I don't know. I don't want to say that they haven't provided us or that they have provided us. I don't know. So I certainly follow up, but I'm not aware of. I haven't been provided results, so I don't know.
Well, I mean, what I'm getting at is, we're in a situation, and it was predicted last week, that additional schools were going to go to virtual learning. They provided us a list of the metrics they make that decision on, but they haven't told us what the metrics are. The actual numbers. In the briefing Kate and I just covered, it said it's too complex for the public to grasp, and that's not a direct quote, but that's the idea that left me with.
Yeah, I was listening. I listened to the response.
Do you have any of these metrics? I mean, what are they?
Yeah, okay, so here's a perfect example. So we obviously had this 5% metric that the state said don't use that, but they have not provided us any metric for when we should consider moving to a remote. We actually had Councilmember Rice, and he talked about this, the Board of Health has a regulation. There was a call with the CDC earlier, I think last week, where the same question was asked, what metrics should we be utilizing for the conversion to virtual? And there was no answer description from the CDC. So we've been left at the local level to try and figure it out, essentially, just make some guesses. But parents don't like guesses. They say, well, why did you create this threshold? What was this threshold based on? We made it up because we don't have anywhere else. There's no Omicron specific data on school systems and how to operate with this. We're all figuring it out as we go. And so I think that's the best answer I can give you, is that, every decision, there's the only way we can operate now is because we have no federal standard, we have no state standard, is to just assess on a case-by-case basis and the individual circumstances. Now, some of these decisions are public health influence, meaning the cases, the case rate, et cetera. But some of them are much more operationally influenced, like I think as they described on the meeting with the council just early this morning, some of them are as complex as, is this teacher actually teaching the course that they are subbing into? And what is the quality of education that's being offered? that's much more subjective in terms of, what percentage of teachers are teaching out of course. I guess you could make that as a metric. What percent? I mean, so some of these, we have struggled with defining a one-size-fits-all metric that applies to all schools that we can defend with data, because that doesn't exist, because no one has gone through an Omicron surge before. And so this is the complexity of where we're left. No one wants to give us feedback from the federal, state, or any other level on how they're making this decision. We've attempted to use the only metric the state provided us as a crux for a conversation, and that was immediately rejected as by the state as being inappropriate. And so we're left in this box of being like, I guess we're just going to have to figure out on a case-by-case basis, because that's just, we have no additional guidance, we have no additional data to base any particular decision on a school closure on. That's incredibly unsatisfying, even for me as a parent. And I'm very well aware of how many of these schools were Title I schools and farm schools that were announced yesterday. I mean, that number is concerning for sure. But at the end of the day, we just don't have a data-driven metric that we can utilize at this point. That's like, we point to that and say, that's why we did this. It doesn't exist. And I wish it did, because being objective would be much easier with parents. But the reality is, we just don't know what that metric would be.
Is there any evidence you're seeing that parents are cooperating by reporting in information by that Sunday deadline? I mean, are people providing the information? And of course, the challenge beyond that, as you and Kate were just discussing, there's not enough test kits to replace for the next coming week. So, I mean, is this testing protocol producing at least some results that are helping you all make these decisions?
Well, I mean,
reporting the information.
Well, I will tell you this. I mean, our community metrics and what we're seeing in MCPS are improving. I know there was a lot of critique around, we should have closed. There was a lot of critique from some segments of the parents that said we should have closed the first 2 weeks. Our numbers are bad because of our leaving schools open, and we're seeing a rapid decline. Even as schools were open, because obviously we've been able to make kits available. We got through the holiday season. I'm not saying we should take credit for all. This is Omicron. It goes up and it goes down. But obviously, we've been able to support that with the testing availability, not just through schools, but many parents were accessing library-based kits, childcare-based kits. Many of them are now ordering them from the federal government. So the testing has been much more ubiquitously available over the last couple of weeks than it was during the holiday season. And so obviously, I think that we're seeing we didn't give away all the tests we had yesterday to give out to the library system, which is a reflection of the fact that the community demand is slowly starting to be more manageable. And that's reflected not just in the school system, but across the community. And so I think for those reasons, we are seeing the positive benefits of people having more access to rapid tests. Again, I said this last week, them reporting the results to us is far less important than them taking the tests and acting on those results. Yes, I would love to know a complete picture of what our community COVID situation is. It would help us make better decisions. We encourage people to report. But if they're not going to report, as long as they're going to live by the results that they get from that rapid test, that's the most important thing. And so even what gets reported to us, and I don't have those numbers to tell you, even what's reported to us, even we know that that's not likely representative of the full benefit that the rapid test kits have offered.
I understand, and you've really helped me here. Let me just get one last detail on the yield. When I look at the dashboard, they're hard numbers. Active quarantines, total students quarantined, total cases reported. Where do those cases come from? How are they reported? Are they reported to a school nurse? They reported to the health department, reported into a state database? Where do these numbers come from?
So there's two ways that the MCPS numbers are generated. They're typically reports into the school system via the schools. They do, some students still report to schools, but they also have a centralized reporting system now where you can report directly to the administration, and then they distribute down to the schools themselves. Now, I will tell you that we're cross-referencing that with Maryland Department of Health data that they provide to us for clinically reported cases. But neither of those is obviously going to be a complete picture given rapid tests that are in the community. And so we have been and will continue to cross-reference the MCPS provided data through parents with what the Maryland Department of Health is receiving from clinical laboratories to corroborate or not what's being reported through the school systems. And so, that I think that's sort of the back end data analysis that's occurring. But what you're seeing on the MCPS dashboard is, my understanding is, the self-reported parents reporting in typically.
Okay, so a parent would either report in the test result or a school nurse would report the knowledge of a case, and that's where the number comes from. Make sure I have that accurate.
That is my understanding, and I can certainly verify that afterwards. I don't think we're incorporating anything from, because obviously we're delayed on our results at the county level, because obviously PCR tests are run, they're received 24 hours later. The state reports them when we receive them. It's typically a lag of a couple days.
Okay, thanks for the detailed answers, and my apologies to my media colleagues who had to endure a sort of sausage making line of questioning. So thanks.
Okay, thank you.
Thank you, Scott. There was one more question from Kate Ryan regarding the list of libraries making the masks available starting this Friday. Same locations and times as the test kits was the answer on the chat from MCPL Director Anita Vassallo. Reporters, I do not see any more requests from questions from you. Going once.
I have one more. I imagine you're not going to throw these 4 million masks out into all the branches right away. I'm wondering maybe even Nita can address that in terms of the capacity of how many you can get out the door at each of the branches, kind of as we start up on Friday. I know that's kind of a specific question, but.
Sure, Steve. Well, we're going to be distributing the masks beginning Friday during the same time as the test kit distribution. And we have seen a little bit of a diminishment in the lines and people eager to get the test kits. So as we are able to hand the test kits out very, very rapidly, and I think the mask distribution will go just as quickly. So I don't know how many we'll be able to do, but I think it's going to be in the tens of thousands.
On like each day or just depend?
Yes.
Okay.
No, if you look at the two links that I posted in the chat, those are the locations and the times of the test kit distributions, which happen Monday through Saturday.
Right.
So the mask distribution will just flow along with that.
Okay. No, I just want to clarify that. Thank you very much.
Steve, I think just for better context, I think what we've sent to them, so obviously Friday and Saturday are the 2 days that they'll be operating, then they'll take a break and restart on Monday. So Friday and Saturday, I think we've provided them 2 pallets, which I think is about 28,000 masks for those 2 days. That gives you about 14,000 per site that would be available. Now, I'm not presuming that they'll run through all 14,000 at each site, but that is what they have available to them at each site. And we'll reassess how many we need to supply to the libraries based on how many are given out on the first 2 days. So we did the same thing with the first test kit distribution. We kind of said we gave an amount, we gave more than we thought we could give out. We ended up giving out as much, way more than we thought we could give out. But obviously we did the same thing with masks, and we'll be able to assess based on the first couple of days how many we need to have on hand.
And we do have one final question on the chat. Proof of residency required to get a mask.
So we are asking that it be for Montgomery County residents only. I think we've been messaging that way, but obviously we have not been very scrutinous with regard to proof of residency requirements. So we do encourage, and we are focused this on in our messaging for county residents only.
Thank you, Dr. Stoddard. Thank you, Director Vassallo, members of the media. Thank you very much for joining us today. Stay safe. We'll see you next time. Have a great afternoon, everyone.
Thank you all.
Thank you.